The Ask Medicare initiative presents this video on CMS's Planning for Your Discharge checklist.
When someone close to you is moving from a healthcare facility to a home setting, it's an enormous challenge for everyone involved. Leaving round-the-clock hospital or nursing home care is a major adjustment for the patient, but it also places substantial responsibility on the caregiver.
Every year, more than 44 million Americans make decisions relating to the care of a loved one after they have been discharged from a hospital, nursing home, or other healthcare facility. To help caregivers meet the challenges during this transition, the Centers for Medicare and Medicaid Services, or CMS, created the Ask Medicare initiative in 2008. It supports the nation's millions of caregivers with informed guidance on a whole range of issues and concerns.
One of the things that we find out when caregivers are new to this is that they're coming into it in a crisis situation. Caregivers are very stressed. There's nothing in place in the home. There's no equipment there yet. They're finding out that mom's going to be home in a day or two, and they have to get all of this taken care of very quickly.
CMS knows transitions in care can be confusing and stressful, but knowing what to expect and where to go for help can make those transitions easier. That's why CMS developed the Planning for Your Discharge Guide. This detailed checklist helps patients and caregivers answer the most important questions that arise when preparing to leave a hospital or skilled nursing facility.
CMS has several tools for the transition period. One is a discharge planning checklist, and it's available on our website. And that discharge planning checklist allows the caregiver, the care recipient, and the provider to partner together to make sure everyone involved understands the next steps in the transition in the care setting.
The Discharge Planning Guide has a unique question and answer format. It starts with questions about who will provide the patient with at-home care, where the care will be given, and what level of assistance the condition requires.
Anytime you have a patient in transition, there are very many things to consider. You need to look at how much time is it going to take? Do I have that amount of time to give? Am I going to need assistance? What are the medications the individual will be on when they get home? And do you know what those medications do?
Sometimes, in planning for transition, details are overlooked, such as equipment the patient may need once they're back in the home. The guide suggests these items, such as a walker or wheelchair, be purchased in advance.
Suppose mom or dad is coming home and you, the care provider, you, the caregiver, are in charge of their care. You might want to know, is mom or dad able to sit up on the ride home, or do you need to provide something where they need to lay down in the back seat or need to keep a leg elevated? Can they eat unassisted, or is there a special diet involved? Are they going to be able to rest flat in a bed? Do they need a special bed? All sorts of things like that you need to think about, and our discharge planning checklist can help you with that.
Other important questions focus on the psychological and emotional impact of losing one's independence and can be awkward to ask without the help of a pre-written checklist. Also, there are the financial issues, like what types of services and drugs are covered by the patient's insurance policy and which will have to be paid out of pocket.
With any transition in care, you also have to think about the basics and what's next. There's almost always some follow-up care involved. You have to think about what appointments, what tests your loved one might need in the coming weeks.
This video touches on just a few of the questions addressed in the Planning for Your Discharge Guide. The guide also provides a list of publicly funded agencies to visit or contact for additional help and support. During this important time in the lives of patients and caregivers, CMS is here to help guide you in the right direction. Caregiving can be a challenge, but it's also incredibly important. The Ask Medicare initiative offers help and support. Visit www.medicare.gov/caregivers for more information.